pregnant people who died specifically in August last year, 1 month after the Delta variant became the predominant variant in the US then. And now that the Omicron is fast spreading, she says she's even more worried for the unvaccinated and pregnant. But what is the current status in Nigeria? Joining us in the studio here in Lagos is Dr. Gregory Ohihoy. He's an obstetrician, gynecologist, and a chief research fellow with the Nigerian Institute of Medical Research, NIMR. Thank you for joining us on the program.
My pleasure, Millicent.
All right. So yes, the National Primary Healthcare Development Agency said pregnant women, lactating mothers can take the vaccine, the COVID-19 vaccine. Is that still taking place?
Yes, and then that's the recommendation worldwide. You know, the CDC in Atlanta, that's the US CDC, has very clear recommendations on the use of COVID-19 vaccine in pregnancy. You know, like the data you are actually quoted noted that, you know, the mortality from COVID-19 for pregnant women was quite disturbing, particularly in the early stages of the pandemic. And with the vaccine now known to be safe, at least from the current available data, it makes sense that our pregnant women should have this vaccine. They should be encouraged to have the vaccine, irrespective of the stage of the pregnancy, first trimester, second trimester, third trimester, puerperium, when they are breastfeeding. You know, it's safe for them to have this vaccine.
Well, the question now is, are pregnant women in Nigeria really taking the vaccine? Is there any data to show the number that have received?
I think the real problem is that the communication, the messaging is not correct. I think we have to target pregnant women and let them know that it's safe for them to take this vaccine. We should incorporate this into our antenatal care program in many of our public settings. It should be a part of the antenatal care program. We should come out with practical strategic programs to encourage the pregnant women to take the vaccine. Just like we encourage them to take their tetanus tozoid immunization during pregnancy, we should make it a part of the health talk we give to them. You see, the challenge I have is that if you don't come up with a strategic program to solve a problem, you won't get the answers that you desire. We can't wish it and hope that the pregnant women will just take the vaccine. But if we encourage them, we incorporate it into our current antenatal structure, particularly in public hospital settings. We develop jingles, you know, deliberate public health effort to raise the awareness, we'll be able to raise, you know, vaccination rate among pregnant women.
We'll come back to some of the beliefs and perhaps myths concerning vaccinating pregnant women. But pregnancy, is it one of the underlying medical conditions that makes COVID-19 more susceptible to attacking them?
Not necessarily. I mean, the evidence we have so far doesn't show that pregnant women are more susceptible to COVID-19, you know, like as per a special group that is more susceptible, no. And we know that generally with pregnancy, there's relative drop in the immunity level. And anything that can drop your immunity level will make COVID-19 more aggressive. Remember that you're also dealing with two situations. You are also increasing the risk of your unborn child of having COVID-19. And the evidence is not so clear whether there's transplacental transmission of COVID-19 to the baby. You know, it's still out there in the jury. And some data says there's transplacental transmission, so data doesn't support it. But what we know, which is more important, is that the vaccines are safe and they are effective. And we should encourage the pregnant women to take the vaccine.
So how much of that do people really know? Because there are fears about essentially it being associated with preterm delivery, underweight in the newborn. I mean, is there any study that shows that these vaccines are actually safe? And also, the back end is those who are, you know, rendering these services, antenatal care, are they really sending the message? Or, because I know some health workers who actually don't believe in the vaccines to start with.
Exactly, Abi. I think the last point you made really describes the situation we have. You know, people have to, the health workers themselves have to have that conviction before they can even convince the pregnant women. There's enough data. You know, like I was just reflecting before I came to the studio. COVID-19 is no longer new to us, relatively. This is the fourth year, Millicent, it's the fourth year. It's 2019, 2020,
December
2021, 2022. So it is the fourth year we are dealing with COVID-19. There's some things we now know. I mean, we could have feigned ignorance, you know, in the beginning and say we don't know many things. We now know there's enough data available in literature, available for those who are interested to show that, you know, the vaccine is safe in pregnancy and people should be encouraged to take it. Of course, there will be myths.
Deputy Director, Research Innovation, Professor Jeffrey Mfalele, many thanks for joining us today.
welcome.
The Omicron variant is driving record daily cases of coronavirus from the US to Australia, adding pressure on health systems. Now, daily coronavirus infections in the Netherlands have soared to a record high. Officials confirm that Omicron has become dominant in the country, while Israel's health ministry has also announced nearly 12,000 new coronavirus cases, the largest daily rise in infections since the beginning of the pandemic nearly 2 years ago. Here's more of the global update.
Israel has changed its COVID-19 quarantine and testing policy in what the health ministry described as an effort to ensure continued protection for vulnerable populations from a surge in infections fueled by the Omicron variant. PCR tests will be earmarked for people aged 60 and over with weak immune systems, while those at lower risk will be checked with rapid antigen tests. The country has confirmed around 1.4 million infections since the start of the pandemic and more than 8,000 deaths. About 60% of its 9.4 million population are fully vaccinated. The United States has reported nearly 1 million new coronavirus infections, the highest daily tally on any country in the world, and nearly double the previous U.S. peak set a week ago. The number of hospitalized COVID-19 patients has risen nearly 50% in the past week and now exceeds 100,000, marking the first time that threshold has been reached in a year. Australia's daily COVID-19 cases has hit a record high for the third consecutive day, further straining hospital resources and testing facilities as public anger grew over the handling of a fast-moving Omicron outbreak. New COVID-19 cases in India surged to 58,097 over the past 24 hours, a doubling of the daily tally over the past 4 days. Health experts have called for preparations to ensure hospitals are not overwhelmed by a new wave of patients. Hong Kong leader Carrie Lam has announced that the government will introduce a series of new measures to curb the spread of COVID-19. The new rules include a ban on flights from 8 countries for 2 weeks from January 8th, affecting Britain, the United States, Canada, Australia, Pakistan, Philippines, France, and India. Singapore's COVID-19 task force says it expects the Omicron coronavirus variant to cause a bigger wave of infections than Delta and urges the country to prepare.
Yesterday alone, we reported 438 Omicron cases. Hence, it is very likely that we will see an Omicron wave quite soon, with local and international evidence indicating that Omicron is more infectious compared to Delta. We must be mentally prepared that the Omicron wave may be greater than the Delta wave we had experienced before.
Over in Europe, British opposition Labour leader Keir Starmer has tested positive for COVID-19. He had been due to face Prime Minister Boris Johnson at a question and answer session in Parliament later today. Starmer previously tested positive for COVID-19 in October. Poland's President Andrzej Duda has tested positive for COVID-19. He had previously tested positive for COVID-19 in October 2020. The president's aide says he's been vaccinated 3 times against COVID-19 and is in isolation with no serious symptoms.
We have more updates on our website, channelstv.com. You can find also a better understanding of the pandemic, plus other stories, breaking news. It's all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.
Be patient. Everything in life will go exactly how it's supposed to go. At times you will feel like an outcast, that you don't fit in, but you will discover that being your own clique will be your strongest attribute. In life, you're going to face many challenges, many moments of adversity. There are going to be a lot of successes and failures too. Those moments are going to create your character, build your integrity, and they will become your beauty marks.